Hello, everybody, and welcome to the Jewish Community Foundation's Access to Insight. My name is Ollie Ben. I am the Director of Philanthropy and Social Impact for the Jewish Community Foundation. We've been doing Access to Insight since the lockdown began. The purpose has been to build community and to help people make sense of this incredibly novel and challenging time that we're all going through. Today, we're going to do something a little bit different. At JCF, part of our mission is to educate and inspire our donors. And one of the things we love to do with donors is take them on site visits. The last site visit we had before the lockdown was actually to the La Jolla Institute of Immunology, where we learned about this thing called the coronavirus that nobody had really heard of at that point. And obviously, we are in a very changed world today. We obviously cannot do in-person site visits, so we're going to be trying a virtual site tour today, which is very exciting, and we're very proud of the folks at 211 San Diego for putting in a lot of work to hopefully make this a really engaging and exciting site visit. Before we get there though, I would love to introduce our CEO, Beth Cyril, the CEO of the Jewish Community Foundation, who is going to be doing a quick news update and welcome from the Jewish Community Foundation. Beth, over to you.
Good morning, everyone. Thanks for joining us again. I know we have some new people who are less familiar with the foundation with us today, so I want to share a little bit about the foundation, but I also want to welcome our fund holders and our longtime supporters who I know are joining us as well. For those of you who are not familiar, the Jewish Community Foundation is the largest grant maker in San Diego. We have facilitated about $1.6 billion in grants in our 50+ years. And most of that is in the past 12 to 15 years. In this COVID period, we have 3 emergency funds that I'll talk about in a minute. And we have also on our website, you'll find a number of resources and funding ideas to support racial justice and equity, if that is of interest to you. We'll also be having some access to insight on racial equity issues coming up. At our core, we believe in the power of every individual to make a difference, and that together we can change the world. And our programming is really about helping to expose all of you to what's going on in our community and in our world, so that we can help you change it in the way that matters most to you. Just a minute on our COVID-19 emergency funds. We do have one fund that we've partnered with the Jewish Community Federation and the Leishtag Foundation to support the Jewish community during this time. We've made a number of grants and loans from that fund, both to help humanitarian efforts and organizationally to enable the infrastructure of our community to survive. We also have 2 other funds that serve the secular community. One is focused on humanitarian needs, and the other on public health. And to date, we've made grants to about 14 organizations. You can see them on your screen that are supporting the humanitarian needs, food, shelter, etc. We expect that need to grow significantly, particularly as federal assistance will expire next month. So we encourage you to look at this fund. And then our public health fund has provided grants to organizations specifically around PPE, personal protection equipment, direct services to patients, covering basic health needs, and promoting public health at this time. So we're very grateful to our donors, and we will be continuing our efforts to meet the needs in the community that appear to be growing pretty significantly as COVID continues. So with that, thank you all for joining us, and I'll hand it back to Ollie for the meat of our program.
Thank you so much, Beth, for that news update. As we're about to get going with 211, we wanted to ask you 2 quick questions as our audience. So I'm launching a poll, and this is so that we can find out a little bit more about your relationship with 211 and JCF, and what you know about 211, because that will help Bill and Jessica and Cami from 211 tailor their tour to you. So feel free to take a few seconds. I know the first question is kind of a long one. And the first question is multiple choice, so check all the boxes that apply. And as we get those answers in, I will then share that information so that the team from 211 can tailor their information to this group. And I would say that Jessica and team, if you want to turn your cameras on now, you should feel free to do so. And we're getting some really good responses to this poll. Thank you. So it's actually really interesting. Well, I'll just say the results because you guys on your phones aren't going to be able to actually see this because your screens are too small. So basically, the majority of people, 60%, said that they signed on because they are interested in 211 San Diego. About almost half also said that their relationship with JCF is why they decided to join. 42% said, this is multiple choice, which is why it adds up to more than 100. 42% said they are interested in understanding about community support resources generally. And a third said that they signed on because of their relationship with 211. So thank you for that feedback. People are split kind of evenly between knowing nothing about 211 San Diego, being not very informed, being somewhat informed, and being a little bit informed. So you've got a nice even split of people there. So hopefully that information will be useful to you guys. And I'm going to turn it over to Jessica. Jessica Peter is the Senior Director of Philanthropy, a new role for her at 211 San Diego. And she has been the architect, along with Cami and Bill, of what we're doing, what they're going to do today. And so now I'm very excited, Jessica, to turn it over for you. For you, it's not a virtual tour, but for everyone else, it's a virtual tour. So over to you, Jessica.
Thank you so much, Ollie, and thank you everybody for being here today. Thank you especially to the Jewish Community Foundation for hosting us. This is a really amazing opportunity. So 211 San Diego was established in 2003 as the nonprofit. It's a countywide nonprofit to serve as the 211 dialing code to help people access services like food, shelter, healthcare, and even in times of disaster. So my role as the Senior Director of Philanthropy is new, as Ollie said, and it's a new path that we're trying to forge. Up until now, though, I've been with 211 for 10 years, and my role has been in business development. I've been writing grants and contracts for the past 10 years, helping to build the foundation for the programs that you're going to learn about today that largely define the work that we do. But there's a lot more that we can and should be doing, and that's why we're here today. We want to start expanding the kind of work and opportunities that we can create for the people in our community. And one of the ways that we've been doing that is through the Community Information Exchange, the CIE. In 2018, we pushed this out, and it's an ecosystem, and it's a network of 87 providers and growing that are working together using a shared technology. And through this shared technology, through this system, we are sharing client records, we are exchanging referrals, and we're doing so much. So just to give you a quick example of what that looks like, I might step inside because I'm hearing airplanes around me. To give you a quick example of what that looks like, if you were to call 211 because you needed food, you might let us know that you have an underlying condition, and that means you can't go to a local pantry because of COVID-19, and that would expose you. So we could send off a couple electronic referrals to our partners, and by tomorrow night, within 24 hours, you would have food delivered to your home. And that kind of opportunity that we are able to do with our partners, that's really innovative, and it's new. And so that might be simple, it might sound simple, and we're trying to create a simple experience for our clients, but it's so much work on the back end. We're working with our partners are putting in so much effort, and we're designing those referrals, we're designing how that looks and the triggers in the system and the technology, designing out the software that goes into making that happen. And I really have to say that for the past 10 years, I feel like I've been working at a startup, and we are at this precipice in our future that it's just so cool to see. If you'd walked into our building 10 years ago, you would have seen a staff of 25 people. But today we're in this amazing building that you'll see has room for 200 plus people, but a lot of us are working from home right now. But anyway, so the client experience at 211 is changing, and we're answering a lot more calls than we typically were. So before COVID, we were answering 1,200 calls a day, but that's doubled, more than doubled. Now we're answering 2,500 calls every day. And the people that are calling are mostly needing basic assistance. Like they want to be healthy, they want to be safe. And so, for example, last week, somebody that called, she said that she hadn't paid her bills in a couple months. She was unemployed. She'd applied for CalFresh. She was waiting for that application to go through. CalFresh is the food stamp program. And we weren't surprised by that. I mean, we've never seen so much demand for CalFresh applications to go through. I think we've completed like 8,000 in the past few months since COVID started. And normally we'll do 10,000 in a whole year. So anyway, so she was trying to get money for food because she was trying to sell everything she owned on eBay to make ends meet. We ended up finding out that she hadn't filed her taxes for a few years because she had such low income. So we knew that she might be eligible for earned income tax credits, which are something that you can actually get a few years after your misfiling date. So we connected her to tax assistance, and so she's now trying to access those benefits that'll at least give her some money to tide her over. Just another quick example, that same day a pregnant woman called us because she was trying to get Medi-Cal coverage. She had an upcoming ultrasound appointment, but she didn't want to miss it. It was an important one, and she needed to have the coverage because she couldn't afford it. So we submitted an application for her, got her enrolled within 24 hours, and she made her appointment because we also scheduled her a Lyft ride through a program that we managed. And it was free, so she didn't have to go on public transportation where she could have been exposed to COVID. So those are just two examples of the kind of work that we're doing. But if you think about it, on that same day, more than 2,500 people called us. So we were talking to 2,500 of these people, these stories. And people that are calling us, they have more than one need. And if we don't address their needs today, they're going to get more serious and they're going to have bigger problems further down the line. And so when you think about that, the healthcare system is going to end up treating physical conditions instead of us all addressing the real problem, which are high rent, high utility, low income, substandard housing, things that are affecting people's lives every day. And so we are not only building efficiencies, but we're doing it to be effective and to be preventative. And so I say all of that because I want us to be able to share this vision of what that means today. And so I'm excited to introduce our president and CEO, our new president and CEO, Bill York. You may have known John Ohanian. Some of you may have known him. He left in April, and Bill took over right in the midst of COVID, which is he's no stranger to disasters because Bill ended up actually coming to 211 in 2007 during the wildfires as a volunteer. And he ended up sticking with 211. And in his experience here, he figured out that there's a disparity in the kind of customer service that we're offering people who are struggling to put food on the table, and the kind of customer service that we can give to other people. So Bill had worked at American Express Black Card customer experience for many years, and he was able to make anything happen. And he's trying to bring that vision here to 211 today. So I want to introduce you to Bill York.
See, I'm going to switch cameras right now on our virtual tour. Thanks, Jess. So I thought I'd give you a little virtual tour of 201 San Diego. Thank you again. So Jewish Community Foundation, Ollie, all for making the call today. I think there's over 50 people. My name again is Bill York. I am proudly the new CEO of 211, taking the realm or taking the reins from John Ohanian, which I know many of you know, my personal mentor. And it's true, I started here in 2007 fires, and a few weeks after that, John said to me, like, we could do some fun things together in building 211 to a new type of organization. And it wasn't long after that we did see that the type of calls that you would consider social service calls or food calls, that when we were talking to government funders, I remember a conversation we got into was saying, well, just answer the call. It didn't matter how good the call was. It just needed to be timely and you'd get them something. And I remember John and I sitting in the room thinking that was not the client experience wherever you sit and wherever your economic background is. And so we've spent the last 13 years actually responding to opportunity, but also community need. So I'm going to talk a little bit about how we got there. And one of those ones was disaster. So those fires put us on the map. Interesting enough, it was after 9/11 that the FCC said 2-in-1 should be used in a fire or disaster. And you can see in the middle of COVID, we're still used that way. In fact, we've become the flagship of how disaster 2-in-1 services. We pull off a whole host of 911 calls. We do public health, most of the fires, and we've done a resume across the country. That actually gave us an opportunity to build a better 2-in-1 in the initial work that we were doing. So, and build it all. And we spent the next 2 years doing that when the opportunity around food insecurity from the 2008 Farm Bill came. And with the Farm Bill, they really wanted to reduce stigma around food stamps, which I still think is, has a lot in that name. And so they renamed it SNAP, and here in California, we call it CalFresh. For the last 12 years, as Jessica mentioned, we have enrolled over hundreds of thousands, putting millions of dollars of food on people's tables. And it was another venture into how to do quality work. Again, responding to opportunity, maybe being a little reactive. And we've spent so many of our years doing that type of work and continuing to build what a social service 2-in-1 dialing code can do. And it's pretty cool to have a 3-digit dialing code. So we did see the nature of 2-in-1 and the number of calls increase every year over year, with the number being simplified. So moving on to, I'm going to bring you up to our call center to show you a little bit. As Jessica mentioned, we're not quite the same organization. We've grown from 25 people in 2007 to about 210. 40% of that growth happening in the last year. So expanding all of our programs, our county support programs, and others, and even our COVID response. So I thought I'd show you what's here. Again, you're looking over at our Connection Center, where we were able to move into a few years ago as we expanded. One, 3 of our tenets is to have operational excellence, to be a place you want to work, and to have a client-centered experience, a quality client experience. Building this place with the help, a lot of the people that are on this call, our board of directors, Emily Einhorn, who was a past board member, Henry Heimson is on the call today, and I know Terry Kalachis is on the call as well, so help directly support, and Henry's brother, Merrill and Robert Heimson, as well as Sophie and Dan Einhorn, helped build this place, which is really an employee-centered focused place that we really wanted to be a place to work. This is our town hall, again, that you usually in non-COVID times, you'll actually see it's very active and very buzz and full of life and activity. We're gonna head up to our call center floor, which has a skeleton crew of people that here to making sure that they're safe and well. So we have one department that's still working during COVID. That's a county access line that we're stuck to the building doing that. So about 40 staff remain here. We try to work out this Zoom with no kinks in it. So if you haven't been to 2-in-1, this is our main floor. And you can see that we're divided up by many different departments. A lot of people don't realize all the things that 2-in-1 does. John and I and our team have been able to build our 2-in-1 line, information referral, above the best and one of the best in the country. We've been able to build the CalFresh Enrollment Center, where we actually do healthcare enrollment, again, covered California, the CalFresh, as well as Medi-Cal. We have a health navigation department. As the Affordable Care Act, as that rolled out, we knew that we need to become better in what that kind of service looked like. So we have 17 staff that all do navigation in the deep level of healthcare, as well as the county support line that is socially distanced through the building here, and then our Courage to Call program, which I'm proud to say, as a veteran, we started about 10 years ago and partnered with Mental Health Systems and BBSD, funded by the County Mental Health Service Act dollars. So we really have spent over the last 13 years building an organization that is responding to a new type of way to deliver those services. Jessica mentioned if someone's looking for one service, they probably need another, and being able to screen in for likely eligibility or add on another program when they're calling for one, we've been able to successfully do that. And actually hiring, training, and retaining our staff over the last 13 years. So we're very excited to be able to grow that. It was great for, it's an amazing opportunity to join and be the leader of this after John's mentorship. And so we're very proud of the work we've been able to do. We have a lot more that we'd like to do. You're gonna hear in a minute a little bit more about CIE and Community Information Exchange. If you think if we are our customer client centered, CIE is business to business and really changing the way that our clients and our agencies interact with each other for better service. It's really quite impressive. Jessica mentioned it launched in 2018, but we've been working on that project since 2011. And just in COVID alone, the use case around organizations that can't meet or see clients in person has just been amazing. We're seeing new uses every single day, whether it's home delivered meals, whether that's seniors, whether it's delivering healthcare, supplies, blankets, a whole host of things that now CIE is being used for. We're going to go back downstairs. Some of the other things that we've done over time is with all of that work, making sure that we do that work well, is we have a client insurance, a quality assurance department of over 12 people that work, coach, score, listen to quality improvement of all of our calls. So it allows us to actually continuously improve and our staff to get the support of what a quality call looks like. Again, you heard the Centurion card, the black card experience. I did bring some of that to 2-on-1, saying this is the kind of experience our clients should be offered, again, with dignity. And this is the way we should be teaching our staff to be able to do that work as an inclusive. We're thankful that, as Jessica mentioned, that we have had the gift of contracts that had RFPs or requirements. One of the things we found is there's certain things it doesn't allow us to do. Some of them can be restricted within those things. And we're going to talk a little about that as this meeting goes on. So I do want to sign off for there. I will see you at the end of this call, but that tells you a little about the things that we've done over the last 13 years and the way we've had the growth and thought about envisioning what a 2-on-1 could do. And we're very proud to support and have an amazing team that works here. I'm going to pass this to Cami Christensen, who is at home reporting, that is going to do a CIE up.
Thank you, Bill. Good afternoon. My name is Cami Christensen. I am the Senior Vice President here at 2-on-1 San Diego. I oversee the Community Information Exchange team as well as the Business and Partnership Development team. So I'm going to give you a brief flyby overview of the Community Information Exchange and then talk a little bit about our data. And so the CIE is pretty complex, but just know that we have been evolving, as Jessica and Bill both said. It started in 2011 with just an idea and really came into fruition once we outgrew off-the-shelf software and built it ourselves and released it in 2018. So CIE really is an ecosystem, and we call it an ecosystem because every time we have a new partner join the system, it changes, it ebbs and it flows just like a normal ecosystem. But it is an ecosystem of network partners who have all agreed to use a shared language and outcome measures. They're all using the same type of agreements. We have 89 partners. It is growing every day. There's 89 partners in our CIE. Those partners they've all share the same consenting process. So the first question we get about Community Information Exchange is, how is it possible with HIPAA? And so our Community Information Exchange is an opt-in model. So we take great pride in honoring that the clients who are agreeing to share their information with 89 partners to have joined just this week, because they realize the benefits. And the whole idea of CIE is that we're breaking down silos. We are having our partners talk to each other and work proactively. Helpers are working with each other so that our people who are in crisis don't have to be their best historian, and they don't have to repeatedly tell their story and their situation and their traumas again and again and again. So our network partners all work together. Everyone signs a business associate agreement, and they leverage the 2-on-1 database that's built into the CIE to have an electronic referral, like the example that just told you about when we opened. So that we have, again, helpers proactively working with each other, accepting referrals, pushing electronic referrals. The database itself also has a risk rating score built in. So we have our service provider partners who have all agreed to use CIE for referrals, but they also have assessments built in. So if you're in need of housing, everyone's using the same housing assessment, and the risk rating score is built in to those assessments so that we have the shared language, so that when we say someone's in need of housing, their risk rating score is at risk, or for food and nutrition, they are in crisis or thriving. We all understand that as community providers are working together and what that means. And all of that information is really driving towards a single community-wide longitudinal client record. So that means whether you're Jacob and Cushman San Diego Food Bank or Jewish Family Services or Serving Seniors or Alpha Project, everyone can log in and see the same information on a single client record. And that shows the history of referrals. It shows their assessments. It shows who else in the community is working with that client. And like Bill said, we've been doing this for a while, and a lot of folks joined in for the vision of efficiency and the vision that we were doing systems change work with CIE. But when COVID hit, it really came into practice that folks did have to figure out how to provide services and connect with their clients and connect with each other during the COVID crisis when everyone was at the stay-at-home order. And we meet with our CIE partners. We used to meet monthly. We're meeting every 2 weeks because it's such a fluid, changing environment around what resources are available and how to access, how to get people to the resources that they need. And again, the work of CIE is so transformational. One of the kind of side effects that we were surprised about was how much national attention it would be getting. And so there are communities across the country who are looking at San Diego and looking at CIE saying, can you help us, teach us what you've learned, lessons learned that you guys have been doing this for 9 years. And so we do spend some time working with other communities about what we call the national movement around sharing records and bridging sectors to really drive more equitable resources for those that are in need. I will pause there and move to talking about our data. Both 2-in-1 and CIE together are really data-rich opportunities. And so just to give you a snapshot of what that looks like, we have almost 300,000 2-in-1 records. So Bill mentioned when we moved to having a client record for 2-in-1, that's so folks can build on their record. And again, CIE is an opt-in model, so some folks may choose to share their record with the entire community. And for CIE, we have 156,000 client records. And so again, both of those, whether you're talking about a 2-in-1 record or a CIE record, which is really bringing in not just data from 2-in-1, but also from our different partners. The San Diego Food Bank, the Jacob and Cushman Food Bank, they've integrated their data with their data platform with our CIE. Our local HMIS provider, which all of the housing and homeless providers have to use a system called HMIS. We've integrated not only that software, but also the consenting process with our homeless providers. So that data integration really allows us to create not just a longitudinal client record, but also allows us to really use that data to inform key stakeholders. And it allows us to do more proactive work, to have new visualizations. It allows us to identify what are the trends that we're seeing in the data, what are the, how do we aggregate those numbers and share that with the community. We have definitely tried our best to really do the social justice, to do justice to our callers and to our CIE participants so that we aggregate the information and we share that out to our community. One recent example of that is our housing instability report. So we took a look at all of the callers to 2-in-1, and if they were, when we did a risk rating score and they were considered unstably housed, we looked at some other indicators. There was 88% of those folks had shut-off notices or past due notices for the utilities. So that to us told us we need to make sure that we've integrated with, we do our utility assessment, at the same time we do a housing assessment so that we can move further upstream and identify those who are at risk for homelessness as early as possible. Also in that same homeless brief, we found that 1 in 4 persons that were calling 2-in-1 and they were becoming, they met the definition of being unstably housed, 1 in 4 became homeless within 4 months. And we knew that because of the CIE integration with our homeless system, HMIS system. So those are types of examples of how we are using our data to both help individuals and also inform key stakeholders and elected officials to make sure that we are being vocal about what's going on with our system of care, where there are unmet needs, and making recommendations, very clear recommendations for policy implications that we see. The last thing I'll say is that we just had a write-up that came out a few days ago from the NEJM at Catalyst, Innovations of Care Delivery, talking about what CIE and 201 San Diego are doing. And so in particular about addressing community needs and preparing for secondary impacts of COVID. So we're really proud of the data. We're working really hard to get the data policy briefs out and making sure that we are doing justice to those that we serve. With that, I will throw it back to Bill.
Thanks, Cami. And again, thanks for all being on the call. I did want to answer a couple of the questions, if Dolly, if that's okay, before we go to that next section. I just see a couple of from the information that we presented. So one of them is that okay?
Yeah, it's up to you if you want to do it now or if you want to do all the questions at the end.
Okay, I can answer these two real quickly. I think how the data is kept confidential and safe. That is probably the number one question that we get these days. So we have spent several years in working with a privacy and security officer from the time we procured the new technology that we're using both for the 211 and the CI technology, which is one and the same, which is Salesforce. How we built that with security protocols, additional guardian protection and encryption, and a whole host of actual policies and practices that our staff must follow, as well as any of the CIE partners. So it is one of the biggest and the most highlighted by our board of directors, management, and team of understanding the security of people's information. So it was one of the ones that, you know, from PHI to PII to what is data, how does it need to be categorized, and who needs to be able to see it, as well as the technology to secure it, as well as the people and processes. So it was one of the things, if you had asked me in 2011, as we started down this avenue, that I think that we became well educated on by bringing subject matter experts in with us, some of that being county, some of that our own individual, and then Salesforce and other pieces of technology. So it's the constant on our risk register is one of the most important things. And so it's something we continue to manage. The second is just how many employees and how many volunteers. So at this point, we have 210 actual paid employees. We have expanded over by 40% just this year between COVID and some county expansion. And we do have over 600 disaster volunteers that we could activate. And you can imagine we couldn't do this in COVID. We have the ability, technology, to ramp up call centers, not only at our call center in our facility here at the Connection Center, but anywhere that we could set up a phone center, in another location. What we weren't able to do is bring people together in that type of environment. So we've had to really utilize either subject matter experts like librarians or public health nurses, or additional staff that came on during that time. So we do have an active roster. So I wanted to just answer those two questions. I also want to acknowledge, just kind of moving along, that I mentioned several of our board members that I know I've had, like John, myself, and our executive and leadership team, as well as our staff, have had the opportunity to be mentored, coached, guided, strategized with over the last 13 years. And so I know Henry Heimson's on the call today. I know Terry Kalachis is on the call today, who have been longtime supporters of 211. And not only that, but guides to us. So also Emily Emily is on the call as well. Emily has been a board member for many years, and actually I want to introduce her to say hello and ask a few questions and share a few things. Hi, Emily.
Hi there. Hey. Happy to be here with you. So excited. I'm passionate about Jewish Community Foundation and 211, both stellar organizations that have great leadership. So very happy to be a part of this call today. And I wanted to share, I think, you know, you heard from Bill and the whole team, how all that they're doing and what's happened in the last decade. It's just extraordinary. And what they really can't share with you that I know from personal experience is that they really are seen as state and national leaders in what they're doing. And they're integrating so much information and creating not only efficiencies, but really also creating personal touches and really being personally centric for each of the individuals. And I think that in today's day when resources are so scarce and we're on calls or in places like the DMVs and calling up different organizations, they really are integrating all this information. I think it's very exciting. Dan's not here with me today, but we're very excited. We believe in this so much that we've decided to set up a matching grant here. We're doing a 3-to-1 grant. So if we can raise as much as another 150,000, we'll have 200,000. And the whole key, the reason we need to do this, even though there are grants that are received for specific projects, whether it's, the utilities or the healthcare or the food, but this is really such a stellar group of leaders that run this organization, and they need to continue to be visionary and to be more strategic and to fill in some of the gaps that aren't filled by the specific grants. So Dan and I are excited to lead this matching opportunity. Thank you. Bill, are you there?
I think we're turning it over to Jessica.
Okay. On to Jessica.
I told Bill to turn off his video for a second. Emily, thank you so much. We are so grateful to you and Dan and can you hear me? Yeah, and to everybody. Emily, you've been a great supporter over the many years through all of our major milestones, and we're so excited to have this opportunity to have you be our support and help kind of initiate this new phase of our growth with philanthropy and trying to build that kind of support for us. So thank you so much. With that, I think I'm going to hand it back to Ollie so that we can move into Q&A.
Yes, absolutely. So the first question that we received is, besides funding, what are the other ways people can help 211 and the community?
I think that's for me. So thank you for that question. There are a lot of things you can do that beyond just financially supporting 211 and our partners and all of the organizations in San Diego. One of the things that you can do is you can volunteer. I mean, there's justserve.org is a great website that you can go to find opportunities. There's a local Hands-On San Diego, and I know United Way also has a listing as well. You can also donate blood. So there's the San Diego Blood Bank, and there is the American Red Cross that you can go to set up an appointment. And another big thing that I think a lot of us are thinking about these days is you can use your own work and your own volunteerism if you're on boards or whatnot, that you can help create new opportunities for helping create leadership diversity. So those are really important aspects of things you can do. I also would encourage you to just check out our website, 211sandiego.org and ciesandiego.org, where you can see all of the partners, because we rely on them for everything. All of what we've said today, none of that's possible without them. So if you can see what partners we have listed there, we would love for you to support them, support us, and then just get a sense of maybe, are we missing anybody, and let us know. A lot of times we turn to community leaders to let us know what other organizations we should be working with. And we have a long pipeline, but we want to make sure that we're targeting everyone.
Great. The next question that came in is, can you talk about some of the pending projects you have? And I think maybe as part of that, Emily touched on this, but can you also expand a bit about the difference between the the programs that you're eligible for grant funding from various public entities versus what you're looking to do with some private philanthropy?
I'll jump on that real quick, and then maybe Bill or Cammie want to talk to it as well. For the last part of that, the different kinds of contracts that we've had over the years have been pretty specific. So they've had a lot of prescribed scopes of work that we've had to follow, which have done big things for the community, but it doesn't leave that wiggle room for the flexibility for us to be more innovative and work with our partners to identify referral pathways like we talked about earlier, where we were able to establish that electronic referral that delivered food to somebody's home, that ended up delivering food to someone's home. So those kinds of opportunities aren't available with contracts. Those are things that we're looking for philanthropic funds to help support so that we can move forward with designing something very special for our community. Ella, can you remind me what the beginning part of your question, the new projects? Some really exciting stuff that we're working on. One of the new projects is called My 211. It's a mobile app. It's like an app. It's mobile, so anybody can access it through a desktop, through a phone or whatnot. So you can actually create a 211 profile for yourself. So when we talked about how we're tracking a person over time now, we actually allow people, this isn't rolled out yet, it'll roll out in fall. We're allowing people to create their own profile so that they can they can search for services, they can communicate directly with service providers, and they can track things over time. And in due time, we'll be able to send them alerts if they're eligible for certain programs, proactively, again, trying to take that preventive angle. So that's being released, and we're excited actually because we have a great lead who's helping us. Andy Ballister, who co-founded GoFundMe, is leading that user experience design. So it's going to be awesome, but we are still looking for supporters for that as well. So we're rolling out phase 1 this year, but there's a lot to be done with that project. Bill or Cammie, do you have any others that you wanted to speak to or even elaborate?
I do one, to that point of My 211, and what's the differences with our contract deliverables. And, one of the most proud programs that for myself is that CalFresh enrollment. So we've been able to reduce, because of the 2008 Farm Bill, we were able to outreach, educate, change the concept of being access that entitlement program, so people actually feel comfortable to apply for something they're eligible. That was within the scope, but no one has asked us to what we think the next step is of giving the information into a client's hand, like Meet My 211 can do. We know why people are falling off public benefits. We know that they don't understand the next step, or when is my notice of action due, and what are my next actions. And so being able to put not only the 211 and the community resources, but together with public benefits that I can manage and then even get assistance from 211. So there are some features and things like that I will say those funding streams do not, it's not they don't see them valuable, but they don't show up in procurement opportunities to build a better boat, so I think that would be one for me, looking at the client's perspective. And I think the technology is that, and the use case of continuing putting the information into our both our care coordination teams across agencies as well as our individual clients, that's something that isn't appearing in a lot of different grant opportunities, or but we are definitely moving that needle, and we've seen it before COVID, and we're definitely seeing it now. Cammie, did you want to elaborate?
Yeah, I'll just echo the consumer voice is really something that we're acutely aware of and paying attention to. The only other thing that I'll add is really in the future looking at what we can do as an organization to move as far upstream as possible. So whether we're talking about a new partnership with the county's child welfare services to get to families who are at risk but not meeting the requirements for an actual protection order, how can we help those families as early as possible? Working with our Regional Task Force and the Homeless Partners to create a shared housing program where we leverage CIE technology to match up folks who are at risk for homelessness so that they can share a unit. And really looking at our CIE platform and looking at it very person-centered. How do we then improve that to make it more household and family-centered and more 2-gen? So it's really just leaning into our role in the community, and also how do we become proactive and move further upstream so that we can really make a dent in some of the social ills that we see every day.
A question that I'm sure you get a lot, but it's a good one. When does someone call 911 versus 411 versus 211? How do you answer that?
I'll take this one. So, 911 is a, life-threatening situation. So, if you're in some type of danger, a car accident, some type of crime being committed, some type of health crisis where you need to get to, you need to be transported. So that is 911. So 411 is easily, is if you need the number, name and number, and sometimes charged for a business or for maybe a social service organization. But they will just give that number to you and charge a number to your cell phone bill, usually charge a fee. 211, yes, we have a list of phone numbers, but that's not what a referral looks like. There is the programs that we're talking about, and I know we talked a lot about public benefit programs like Covered California or CalFresh or Medi-Cal and Medicaid, but there are 1,200 agencies providing 6,000 services. That could be anything from Alzheimer's services that are not low-income services. They're not all, public benefit programs, right? We see that because there's a high focus on, but there is something in that 2-in-1, 12,000 resources for everyone. So it's not only going over what the phone number is and, how to access them, but are you eligible to receive them, right? So every program exists, whether it's Susan G. Komen or, disaster information. So I think, 911, life-threatening, emergency, safety, 411, I need a number to pizza joint. I don't even know if they exist out here or not. And a hang up, 50-cent charge. 211, we're gonna walk you through what you're likely eligible for, maybe multiple things in the community, layering on different types of needs, and then get you to that right place.
I also want to jump in. Thank you, Bill. That was a perfect explanation. And there's a great intersection, I think, between 911 and 211, especially in times of disaster. Bill touched earlier on our role with disaster, and we've seen this actually play out. We try to use 211 as the kind of phone number for urgencies, not emergencies. And during a disaster, people will call 911 just for information. So that's why we have a role in disasters, so people can call us for the information and leave 911 open for those emergencies. We know that during, I think it was the Lilac fire, Sheriff Gore let us know that there had been a call to 911 from a boy who he was home alone. He was 12 years old and he didn't know what to do. He saw smoke, and in talking to the 911 operator, they immediately realized his life was in danger and that he needed to be evacuated immediately. So they were able to get people there to get him out and put him to safety. And Sheriff Gore let us know that if he hadn't gotten through, if he had to wait, and because people were calling 911, that he could have lost his life. So that role that we're playing, it's a serious role. And I'm glad you asked that question, because it is a difference. And we're there to help each other, 211 and 911, so that we're serving different populations. Different needs.
I think that is a terrific way to wrap it up with that story and that explanation of the real like synergistic way in which you are kind of working together with all of the different public services and nonprofits to provide as much support for as many folks in the community as you can. So with that, we are almost out of time. And we have one bit left to our program, but I did just want to say thank you so much to Bill, Cami, and Jessica, and to all of 2-in-1 San Diego for the amazing work that you do. We are so grateful that you provided this amazing tour for us. It was really well planned out and really well executed. So thank you guys so much. In line with that, I actually want to ask you guys to fill out 2 more questions at home, 2 very straightforward questions that will help provide us some more information, and hopefully it will express that you may have learned some more during the course of this presentation. while those questions are on screen, I also just want to tell you about some upcoming programs that we have for the Jewish Community Foundation. We have not officially announced the date yet, but we are doing a two-part racial justice series that's coming up in early July. The first part of that program is most likely going to involve a formerly incarcerated man who was wrongfully incarcerated and on death row for 30 years in the state of Alabama. And he'll be joining us in the next couple of weeks. And then we're going to be talking about how we move from understanding to insight. So stay tuned for that. And then on July the 30th, it's our rescheduled Access to Insight on Sports with radio personality Scott Kaplan talking about the future of sports. So those are both coming up very soon. We're so grateful to everybody who signed into today. We're so grateful to the folks at 2-in-1 San Diego for giving us this amazing tour. And we will leave this open for another minute for people to complete the polls, or to complete the poll question that we just set out. But otherwise, thank you so much for joining us today. And we look forward to seeing you soon. Have a happy 4th of July and enjoy the long weekend.